welcome the University of San Francisco School of Management Health Services monthly webinar. This month, we'll be discussing women in healthcare leadership and paths to success. I'm Jeanne Moral, a Program Manager 3, overseeing systems initiatives, planning, and communication for the County of Santa Clara Behavioral Health Services Department. And today, I'll be speaking with Alpa Vyas, the Vice President and Chief Experience Officer at Stanford Healthcare in Palo Alto, California. Alpa, how about you say a few words about yourself before we start?
Sure. Thank you very much. It's really a pleasure and honor to be here. Thanks to everybody for taking time to listen and hear a little bit about the work that we do here at Stanford and about me. Again, I am the Vice President and Chief Patient Experience Officer here at Stanford Healthcare, and I've been with the organization for a little over 11 years now, and have really enjoyed not only this position that I've been in for the past 5.5 years, but really when I came into the organization, I came in through our performance improvement team, and it's been an amazing journey just to be able to start out in one department, take the knowledge that I learned there and kind of translate that into the work that we do now within the patient experience. So thanks for having me.
That's awesome. And thank you for providing a recap of your experience in Stanford. But if you had to tell us your life story in 2 minutes, what would your story be?
In 2 minutes, gosh, I don't think I've ever really said much in contained it down to 2 minutes.
You can take a bit more time if you'd like.
Well, I think, just from a career perspective, I often tell people that my career is actually built on spite, and I will clarify what that means. So for my family, most everybody was really geared towards business. My mom had a master's in economics. My dad had a PhD in marketing. He was an engineer by background. My brother clearly in the business world. And I decided that I wanted to pick something that nobody in my family knew anything about. And one of the areas that really came to mind, if I wasn't going to be a theater major, then I thought, well, let me think about doing something else. And then I actually landed in the School of Public Health, of all things, because nobody in my immediate family was directly involved in healthcare. And so it was kind of a first semester, let's see what this is about. And even though the way I got there was not necessarily the direct way or what have you, I really actually started to appreciate the content and the material that we were covering in class. And my undergraduate degree is in public health. And so really thinking about opportunities to engage and help people. I like being around people. I like interacting with people. And then thinking about how I might be able to help them was interesting to me. And I originally thought that I was going to be a clinician, but I soon found out that I don't have the wherewithal to put in that much time and additional schooling. And I found myself, I guess, genetics definitely plays a part. And I found myself being drawn more to the business side of things, and then actually pursued my master's in healthcare administration and haven't looked back since then, and have had an opportunity throughout my career to start out in an academic medical center, be a management consultant in healthcare, and really watch and learn the trends of the industry during that 8 or 9 year period, which was amazing. And then bringing that experience to Stanford. So a little bit of a circuitous route in how I got here, but really great nonetheless. And I might just talk a little bit about the role of kind of patient experience, because when I started out in healthcare, the role of a patient experience leader didn't exist, or at least there weren't very many. And the role in and of itself really came into prominence, I think, about 5 or 8 years ago. And when organizations such as health systems and academic medical centers really started looking at how the patient experience was important and impacted not only outcomes, but reimbursement, et cetera. And being a part of Stanford, we have access to amazing resources. And one of those resources was our design school. So I got to work on projects there and learning the design thinking process and the very first step, which is empathy, and how do you empathize with your customers or end users, really kind of struck me because I came from a performance improvement background, which was very technical. So this was really the humanizing factor, which kind of led me to patient experience.
That's awesome. That was actually my next question about, how you got to be in your role and interested you in your role. But in terms of the organization, how do you empower and encourage others, your team members and others, to act on some of those insights that patients do provide and provide feedback to the organization? How do you go about doing that?
Yeah. Well, I think for me, from I guess my management philosophy is really about transparency. And so any information or context that I can provide my team from where I sit in the organization only helps them to be able to do their job better. And one thing that we always talk about is, how are we listening to our patients? How are we listening to our patients? And there's many ways that we get feedback. There's kind of the more traditional survey methods or questionnaires that we send to patients. We're very active. We have a very active patient family advisory council, series of councils. We have over 13 different councils that represent patients and family who have had experiences at Stanford. And we meet with them fairly frequently, involve them in the improvement work that's happening within the organization. But making data and information transparent to the organization, to the team. So we really are, again, listening to what our patients and families are telling us. That allows us to then think more creatively around what products, what services could we potentially offer to ease the burden of navigating a very complex environment a little bit easier.
So with COVID-19, have you had to adjust? I imagine you had to adjust the patient experience and addressing some of the concerns folks had coming on site, and safety precautions are in place. But can you share a little bit more some of the modification that you've applied these past few months?
Sure. The past year, I think, has taught us quite a bit in the kind of initial surge that we had this time last year. It was definitely an unknown. We were still learning about COVID and the implications that it had on our patients and even our employees' health. And so, and even at the time, things like PPE or personal protective equipment was not in a large supply. So really having to think about, how do we keep our patients safe, our employees safe, was top of mind. And what that did to the patient experience is we had to really pivot in a couple of instances, and many healthcare organizations will talk about this. One of the very first things that we had to do was really be mindful of the guidance that was coming from our health departments, whether it was the CDC or the county, and paying attention to what those safety measures were. And part of that meant our workforce that didn't have to be within the physical location could go remote. And moving several thousand people into a remote workforce was very different culturally, and learning new ways to work. The second part, again, was keeping our patients safe. And what that meant was we couldn't have visitors, or we had to restrict the number of visitors and how long visitors could stay. And at Stanford, many of our patients, we have very complex patients, and complex patients typically have a family member or a loved one or several that are involved in their care. And so it was probably one of the toughest things I think we as a leadership team and as care teams had to really think about, because that family support is always so important when patients are within the four walls of the hospital or the emergency department. We had to think very creatively on how we kept a connection with patients and their families when they couldn't physically be together. And then I think the third big pivot obviously was we couldn't always see patients in our ambulatory environment in person. So again, not knowing very much about COVID at the time, we transitioned to video visits. So helping our physicians and care team members adapt to this new channel of delivering care was exponential. We went from, I think, maybe having less than 2 digits in percentage-wise of our visits being done through video visits to over 60% overnight. And so that was a big transition. So those are some of the ways that organizationally, operationally, we had to change, but clearly now interacting with patients and families in a very different way.
Definitely, for us too, for my own organization as well. And you probably get this question a lot. Do you think telehealth services will remain? And what kind of change do you foresee in the future in terms of how care is delivered to patients and clients?
Yeah, that's a great question, and one I think so many organizations are really kind of seeking to understand what the implications are ongoing. I think there's been a lot of lessons learned. I know at Stanford, one of the things that we have continually been thinking about was after that first surge, and when we came into a little bit more stabilization, the first order of business was how do we safely reactivate our clinics for in-person visits, because we didn't want patients to delay care, and we wanted to, again, create a safe environment. So that was kind of the first order of business. And once we kind of worked through that process, the second question we asked ourselves was, well, we've definitely learned things over the past 5 to 6 months, and with this exponential growth in video and telehealth type visits, what parts of these lessons learned do we want to keep and integrate into the way we do business? So we've actually been working for several months now, for example, in the ambulatory environment, to really understand what makes sense in terms of helping to deal with access challenges, more appropriate use of our physical assets, so the clinic visits in person versus video. And so our clinical teams are actually taking a look to say, what is the right mix of video visit versus in-person visit? What clinical issues really need to be seen in person versus other questions could be answered either video visit or even asynchronously through a message. So our teams are really working through that. I think to answer your question directly, yes, I think it's here to stay. I think how we can most efficiently adapt that channel into how we deliver care is where the rubber hits the road. I think there's been a lot of learning over the past several months for us to consider how we can leverage telehealth, one, to increase access, increase convenience, and then actually think about other use cases where we can use that infrastructure that we've scaled up so quickly. I can give you some examples. I know my team in patient experience, we actually, part of my role is actually running our after hours nurse advice line. They answer questions for patients after hours when our clinics close, but they also do discharge phone calls for our inpatient units in the emergency department. So we're thinking, how might we adapt the video visit infrastructure to potentially schedule discharge phone calls, video visits for patients and families, especially for complex patients who we imagine could be high risk for readmission within 7 to 14 days. So we've got great infrastructure. Let's think about how we might be able to adapt it to other opportunities.
Great. And the one thing, Alpa, that as you're sharing more about yourself and your work, you talk about lessons learned, questioning, seeing what we can do better. So it kind of leads me to the question about, what is your leadership style?
Great question. I think if you were to ask my team, maybe the way they would describe my leadership style, I think one of the first words they would say is transparent. Like I mentioned before, the way I empower my team is to create knowledge, right? And to share information. I certainly don't have all the answers. And, I think one of the things I try to do is bring really great, smart people onto my team to help create the solutions or think through the problems. I think another characteristic would be collaborative. I know that in complex organizations like our own here at Stanford, it requires teams across the organization, across institutions, to really execute on complex problems or workflows, whatever it is that we're working on. And I think perhaps another word that people would use is I do like to have fun when I work. So, we deal with very serious situations all the time, but how can you enjoy the people that you're working with and really kind of celebrate what they're really good at? And I can tell you, I could go through each of my team members and say, these are all the things they do really well. And so I enjoy that as a part of the leadership role that I have. So how do you help those folks kind of really play to their strengths?
That's great. And if it would be great if you can provide a little bit more and elaborate on how do you motivate and rally people, especially in these times, starting, a few months ago, last year with COVID, and, getting people up, like we're almost there in terms of the vaccination plan. But, people during this time with all the things that we have in place, how do you rally people? Because, they may not be in their usual optimistic self, but you being the leader, how do you encourage people and say, hey, let's keep things going? How do you go about doing that?
Yeah, I think for me, it's really drawing people back to kind of the mission of the organization and reminding ourselves to keep the patient and the family at the center, and our teams as well. And I remember when COVID kind of first hit, again, we didn't know as much as we do now, obviously, about the virus, but I felt it was really important to be visible for my team, especially those that had employees that were being impacted by COVID, and showing them that your leadership team is here. We care about you. These are all the things we're doing to try to keep you safe and keep you informed. So I think being present, being, again, visible, being available were ways to say, we've got you. We're here to partner with you to make sure, that we kind of see our way through this. So I think from a team perspective, being there and really being there was really important. And then just reminding people of the mission of the organization. And what I am always so amazed with, even the work that we've been doing lately around vaccination, people raise their hands to be a part of making things better, to work to get vaccine to patients and to community members. They take a lot of pride in that. And so I think just continuing to tap into that and being mindful that we've been at this for over a year. And also recognizing and trying to be mindful of when people are tired, if they're experiencing burnout, and offering the tools and resources to think about how do they take care of themselves, take care of their family. And so as a leadership team, how do you recognize that in your team members and then provide the support that they might need?
Thank you so much. I think that's a great thing to point out, that, being in recognizing the needs of your employees and your staff members, and talking about it too as well. And I like the fact that, the whole being present, being seen. I think that's a great way to show leadership as well. In terms of future years, you being a leader in the healthcare industry, being a woman, how do you see yourself in 5 or 10 years?
That's a very good question. I often speak to early careerists around kind of my own career journey. And I remember the advice that I used to get and actually give on kind of career development or progression. It's funny, like when we first started talking, I mean, the role of a patient experience leader didn't exist. And so I didn't start out saying, hey, you know what, I want to lead a patient experience team. So it wasn't a direct line to where I am now. But the advice I always got and give is fill the gap, right? So be aware of your surroundings and the work that's happening. And if you see that there is a gap in either a role or a scope of work, fill it or ask to fill it. And that gets you experience, and it shows that you're willing to take on more and you're not necessarily being or waiting to be asked to contribute. And so for me, that worked out well. And the opportunities kind of came along. And so now when I think about what 5 years from now might look like, and especially after given this year, I have to say, I'm not exactly sure what that might look like. What I imagine, though, if I can have it my way in terms of where patient experience might play a broader role, is certainly in advancing how we hear our patients and families. So how do we actually get to those deeper insights of understanding and making visible to parts of the organization? Here's really the root cause of some of our challenges, and then taking that information and working with the operational leaders, the clinical leaders, the improvement leaders to say, this is how we're going to fix it. And then advancing that work to say, we're not only going to fix the current challenges, but how do we now extract those insights to think about what the future services might look like for a group of patients or a certain population. I also think that maybe 5 years from now, the scope of patient experience will continue to evolve to include not just our patients, but how organizations might play a bigger role in our communities. And again, I think the COVID experience over the past year shows how healthcare leaders really have to come together to help solve, public health challenges. So.
That's great. And in honor of this month's webinar topic, Women in Leadership, if you could go back in time, what advice would you give to yourself as you were starting out your career?
I think the advice that I would give myself, and it's a saying that we actually have in my team here. We kind of joke about it, and I know my team kind of uses it. And the notion is the answer can't be no if you don't ask. And so I think part of that really for me reflects on one, kind of being bolder about confidence in ideas, and really thinking about, I guess, this notion of kind of self-advocacy, right? It's okay to ask. It's okay to ask questions when you don't know. It's okay to ask for opportunities when you feel that you are ready and can contribute. And without just assuming that the answer is going to be no. And the answer can't be no unless you ask. And I think that we kind of adopt that mindset in our team right now. I do remember, in addition to that, I remember a scenario when I was a consultant and I had worked really hard on a presentation and analysis, and as a consultant, I was a junior consultant, and we were getting ready to present the information to a client, and my natural reaction was to take a seat against the wall and not at the table. And one of our partners in our consulting group walked into the conference room, and he just looked at me and he's like, "What are you doing?" I said, "Well, I'm junior, right? So I just assumed that I would be in the background. And he said, I find that really hard to imagine when you're the one that did the analysis and they're the only one that can speak to it. So you need to take a seat at the table. And I think that notion of taking a seat at the table, when you have the content expertise, when you have the knowledge, I think back to that day and I'm like, what was I doing? But anyway, so I think those are some things, that's some advice that I would give to myself, my younger self.
I think that's a great advice to give to others, knowing that you see yourself as equal and being able to sit at that table. And I think that's something that everyone should know about. But thank you so much, Alpa, for spending your time here, sharing some of your experiences, your insights, and some of really good recommendations about as we move in our careers, what is important, and knowing that you are in a good place, and that when an opportunity arises, you take that opportunity and open that door. So thank you so much.
Thank you. Appreciate the time.
Thank you.
Thanks, guys. I appreciate that. Great being able to connect you guys.
I can't. Can you put your volume up, Bill? I can't hear you.
Oh, can you hear me now?
Yeah.
Yes.
Okay, sorry. I had my boom away. Thanks for taking the time. I think that was a perfect length. Sometimes these things go like an hour or 45 minutes even, and people's attention spans really aren't there. So this was great.
Oh my God, I couldn't
thanks
even
both
listen
you
to
guys.
myself for an hour.
30
minutes is
I was thinking you guys might want dinner or something. I'm like, I was looking at the time. Oh, it's dinner time. They may be hungry, and
No, she lives right around the corner, so we could actually do that together. In fact, but no, I think that was perfect. What I said, like I mentioned, we'll do like a blog post that goes along with it with some quotables from both you guys. No, Alpa, I thought that was really actually insightful, so I think it'll be good.
Actually, he says, actually insightful. Just kidding.
As if I was surprised, but Jeanne actually works with the county, right? Am I right? The county of Santa Clara. So, yeah. I know you guys do some work with them with regard to all the vaccine stuff. And
yeah, we work with Dr. Salmon, Patty Salmon, quite a bit from Santa Clara County. What's that?
Probably with public health.
Yes.
And the public department.
That's right. Yep. We set up a vaccine site in East San Jose. We just launched it like 3 weeks ago. So in partnership with the county.
That's awesome. Yeah. Hopefully we get more supplies and everyone gets vaccinated soon.
Yeah.
And we can go
that's
travel.
the issue. We're ready to go. We have places. We just need more vaccines. So.
All right. Well, I will let you guys go. Thank you so much for this time. I really appreciate it.
Thanks. It was
Thank you,
really
Alpa, for sharing your story.
It was great to meet you. See you guys later.
Right.
Bye.
Yep,
Thank you. Bye. Have a good evening. Bye.
Yeah, thanks. You too.